I'm honored to follow the amazing Sona into a solution space now. So I'll give a little bit of the global context and both the challenge and opportunity at hand. I know that you all have already really addressed the low-hanging fruit in terms of climate mitigation and adaptation through amazing hard work and engagement and great planning and awesome data. And so I'm going to go into some more perhaps obscure and less discussed climate strategies that have health and equity co-benefits. So first, where we're at globally, the Intergovernmental Panel on Climate Change, hundreds of scientists told us last year that to prevent catastrophic impacts to plants, animals, and hundreds of millions of people, we have to limit warming to 1.5 degrees centigrade above pre-industrial times, and we're already at 1.1. So to achieve that, we must cut emissions in half in the next 11 years and get to net zero by 2050. The IPCC said limiting warming to 1.5 C is possible within the laws of chemistry and physics, but would require unprecedented transitions in all aspects of society. My message to you today is that the transformation required is not something to be feared, but rather to be embraced. Because the systemic, economic, and social changes called for to address the climate emergency will actually benefit our health and well-being, our safety, and our security. The factors destroying our planet are also damaging people's lives in many other ways, such that the status quo is hardly healthy or hopeful. When life expectancy has been declining in the US for the past few years, which is nearly unprecedented in modern history, and Sharita discussed those challenges to health both in the local level and nationally. She kicked us off, thank you. And this despite the US spending more on healthcare than the rest of the world combined. The US is the only developed country where maternal mortality is increasing, more than doubling from 1991 to 2014. And Black women are 3 to 4 times more likely to die in childbirth than white women, regardless of education, income, or any other socioeconomic indicator. Americans surveyed by the World Happiness Report are the unhappiest we've been since the survey began. We spend almost half of our US discretionary budget on the military, while the US military is the biggest organizational carbon polluter in the world. And the US Surgeon General has sounded the alarm about a loneliness epidemic. So we have a lot to gain through transformation, which isn't to diminish the validity of mourning and rage at what is being lost right now. Addressing climate change represents a major opportunity to improve living conditions and public health outcomes. There are many no-regret climate measures available that can increase community health and resilience and address social inequities. Changing policies and systems to reduce emissions can also bring us healthy, energy-efficient, and affordable housing, green spaces for recreation, urban and community greening that cools cities, safe places for kids to play and learn, access to affordable, healthy foods, walkable and bikeable communities where there are good jobs and where people know and care for one another. We could shift subsidies and investments to create hundreds of millions of good jobs, guarantee health care, child care, and higher education, provide accessible and affordable clean public transit and housing, reduce traffic, noise, pollution, and mindless commutes. Our economy could protect and sustain and regenerate the planet's life support systems and the people who depend on them. If we lessen incentives to consume, we'll have more time for leisure and arts, friends and family and community activities. We can solve many problems at once with climate solutions that transform systems and living conditions simultaneously, creating the society we want where all can thrive. I'm going to talk to you today about economics, workforce development, and healthy food systems, since I know you've already discussed greening and energy efficiency as strategies. Economic factors such as income, poverty, and wealth are among the strongest determinants of health. In fact, from the poorest to the richest ends of the income spectrum, higher income is associated with more longevity in the US. The irony is, that even the wealthy here are sicker and die younger in more unequal places than the wealthy in more equal places. So everyone stands to benefit from more equality. It is well established that income inequality is associated with myriad health and social harms and with health inequities, such as lower life expectancy, higher rates of infant and child mortality, shorter height, poor self-reported health, low birth weight, AIDS, depression, mental illness, and obesity. California has the highest poverty rate in the U.S. after adjusting for cost of living, and the greatest number of billionaires at 157. Inequality has also been linked to heightened vulnerability to the harms of climate change. In recent years, increasing scholarship has found that places with more income inequality are less likely to successfully curb greenhouse gases sufficiently to avoid climate catastrophe. This may be because inequality is a social stressor, degrading trust and increasing anxiety, which block people from working together to set ambitious targets and unite to meet them. Inequity characterizes not just the suffering from climate impacts, but also the responsibility for climate change. Greenhouse gas emissions levels relate closely to the wealth of emitters, with the wealthiest people in the world emitting thousands of times more greenhouse gases than the poorest. Almost half of carbon emissions arise from the activities of just 10% of the global population, and just 100 fossil fuel companies account for 71% of global industrial greenhouse gas emissions. Policy strategies to reduce wealth inequality that can both reduce health inequities and curb climate change include expanding the earned income tax credit, increases in minimum wages, and other safety nets for the poor. But inequality must be addressed at both ends. Policy levers that can reduce excessive wealth include regulation of executive compensation, a higher taxation rate on capital gains, or the reestablishment of a state estate tax. Employee ownership and worker-owned cooperatives flatten the wealth divide in companies, and these are proliferating steadily. As examples, Cooperation Richmond, just across the bay, is part of a cooperative incubator network that invests in climate resilience projects, like Richmond's Bicycle Cooperative, or one on the East Coast that is a Healthy Soils Cooperative. Many studies link unemployment, insecure employment, or lack of control over workplace conditions to worse physical and mental health outcomes. People of color are overrepresented in the ranks of unemployed and underemployed, which contributes to racial health inequities. Communities with high unemployment tend to be disproportionately affected by disasters as well. All of our climate smart cities and resilient infrastructure building is an opportunity to create smart cities and local living wage jobs that reduce inequalities and wealth gaps and enable people to thrive. In my program, we write labor and workforce development strategies and anti-displacement language into all major climate change plans and grant guidelines. Specific ideas that can be implemented at the local level include local hire policies that promote quality full-time jobs with benefits, job training programs, school-to-career pipelines, small business supports, community benefits agreements, job training and placement for traditionally excluded groups such as formerly incarcerated, youth of color, people with physical or mental disabilities, and structured income support, training and employment opportunities for people working in fossil fuel industries that face layoffs as we transition to a clean energy economy. We currently produce food by emitting carbon, but we can produce food by sequestering carbon. Eating too much fat, saturated fat, salt, sugar, and processed foods is associated with the leading causes of death and disease, including heart disease, stroke, some cancers, type 2 diabetes, and high blood pressure. Eating more whole grains, vegetables, and fruits is associated with improved health. The World Health Organization classified processed meat as a carcinogen and red meat as a probable carcinogen. Animal products, including dairy, are associated with higher greenhouse gas emissions than plant foods, with the highest emissions occurring from production of meats and ruminants such as cattle, sheep, and goats, with beef producing the highest amount of greenhouse gas emissions by far. Plant foods, such as vegetables, cereals, and legumes, produce the smallest greenhouse emissions of foods, with the exception of those transported by air. Improving access to local and healthy food increases nutrition, increases resiliency to climate change impacts, supports farmers, and reduces greenhouse gas emissions. transitioning to more plant-based diets could reduce global mortality by a whopping 6 to 10%, and food-related greenhouse gas emissions by 29 to 70% by 2050. This is not an exhortation to individual behavior change or judgments. I don't care what you eat individually. No single individual created the industrial farming system or the shift of chemicals of war to pesticides, nor chose to spend $200 billion to subsidize U.S. commodity crops in 15 years, roughly 2/3 of which went to feed animal crops, tobacco, and cotton, making them cheaper and incentivizing consumption. We can only make all of the urgent changes we need to slake the climate emergency by being part of an active, powerful people's movement that achieves structural, not merely individual changes. Which brings us to the good news about healthy food systems, which is healthy soils, practices, and agroecology, the only proven way to take carbon from the air and put it back into plants and soil, where it has beneficial effects on crops, the environment, and human health. Soil scientist Ratan Lal suggested that restoring lost soil carbon in the world's soils could offset 5 to 15% of our global greenhouse gas emissions. Building soil through agricultural practices such as cover crops, increasing biodiversity, managed grazing, organic methods, integrating trees into farm and rangelands, applying compost, and keeping soils covered and planted has the potential to increase resilience to pests and severe weather, reducing the need for irrigation and reducing flooding. All these benefits have health implications. And more broadly, investments in climate smart strategies such as these can lead to more agricultural and rural jobs, income security, and social cohesion, better overall health, longevity, and mental health. And as an example of this, greenhouse gas reduction funds are already supporting the benefits of climate smart farming in California through the California Department of Food and Agricultural Office of Environmental Farming and Innovation, which provides grants and technical assistance to farmers and ranchers. So, finally, I thank you for your inspirational presence here, for the work you've already done. And I want to leave you with the thought that the people in this room can collaborate together to embed climate change, health, and equity in all policies to improve health for people right here in this community, and also to show how system transformation can bring more rewarding lives while giving us all a shot at a livable future. Thank you so much.